Hello. Uh, in our series of preconceptional care and first trimester, which we have already done, this brings us to the very crucial junction of the second trimester. The second trimester starts obviously when the first trimester ends. That is, once your 12 weeks are over and you enter your fourth month, you're in the second trimester of pregnancy. And from fourth month to the seventh month is what is called as the second trimester of pregnancy. This is a good period of pregnancy because the problems of the first trimester like nausea and vomiting have subsided. In generally, you are not too big in the abdomen. The abdomen has just started to show at around the fourth or the fifth month. So you're pretty comfortable. So you feel more or less normal. So it's a good time to have fun. It's a good time to travel. It's a good time to have a holiday if you want to. And of course, in the full trimester, you can continue work as usual and have a good time. What are the investigations which we do in this trimester and how frequently do you visit the doctor? Well, after you have finished your NT scan, maybe you have undergone even screening for Down syndrome, so you need to get those reports cleared from the doctor. And if all is well, your next sonography will be around 18 to 20 weeks of pregnancy. This is the important sonography because here, to add on to the first trimester findings of a grossly normal structure, we see the fetal brain, the fetal heart, the fetal face, and all the other structures in great detail to make sure that generally the fetus is normal and the baby is absolutely fine. You can also get a 4D reconstruction of the face and get a picture of your baby's face at this time at the anomaly scan stage. Quickening or baby movements is something which will start now at around 20 to 22 weeks of pregnancy. If you are a first timer, that is you are a primigravida, then you will feel movements at around 20 to 23 weeks. If you have had a baby before, maybe earlier at 20 weeks also. It starts off as a fluttering feeling in the abdomen, which then grows and you can actually appreciate proper movements by around 26-27 weeks. So exciting time for you, a lot to look forward to. Start talking to the baby also, why not? About medication, generally your doctor will put you on iron and folic acid supplements, and also now calcium has to be started. Calcium supplements need to be taken. These are the two basic medicines which are required, and of course, depending on your weight and other features, you may need to add on proteins or add on other supplements like vitamin D if required. But these days, generally the calcium preparations, all of them have enough vitamin D. So calcium and vitamin D generally go together, and iron is the other thing which you need. Yes, iron is also required if your hemoglobin is normal, because second trimester is the time when dilution of the blood occurs and hemoglobin drops. So in India at least, we supplement iron tablets to all pregnant women throughout pregnancy. What are the problems which can occur? Iron can cause constipation. So at times, if your hemoglobin is normal, you can take it on alternate days. But in general, have a lot of roughage in your diet, have a lot of healthy diet, and that should keep you away from the common problems like constipation, which can happen because of iron tablets. The timing of the tablets is a little important because you don't mix them up with food, and neither do you have iron and calcium together. They interfere with each other's absorption, so iron has to be had separately and calcium separately. So that's about the drugs which you generally require in the second trimester. You also will be immunized against tetanus, and in Bombay at least, we are vaccinating everybody against H1N1 or swine flu. So the H1N1 vaccination is taken anytime, fourth month onwards to any time till delivery. We generally give it in the fourth or fifth month of pregnancy. For tetanus, you get 2 doses of tetanus toxide 6 weeks apart. But gradually we are shifting now towards a 1 dose of tetanus toxide, which we give at 27 weeks of gestation. And this is combined with diphtheria and whooping cough. So tetanus, diphtheria and whooping cough all together, which is known as one injection. Boostrix is given at 27 to 28 weeks to prevent you and the baby from these diseases. Basically it is for the baby. So it's important to get these immunizations done. If you are an Rh negative mother, then maybe you may require an RH anti-D injection, but that your doctor will let you know in which conditions you need to be given and which conditions you need not be given an anti-D injection. In investigations, we repeat your hemoglobin and we repeat the glucose test, that is the 75-gram glucose challenge test, and a urine routine at around 26 to 28 weeks. Now, we have done these tests in the first trimester, if you've heard that video, but we need to repeat it now because many women who had these tests normal earlier now can show what is known as glucose intolerance. That means when you take that packet of glucose in half a glass of water, and after 2 hours if you give your blood, and if the reading is more than 140, means you have got glucose intolerance, and you to check that immediately. And we have a video on why gestational diabetes is important, so you can have a look at that to understand why it is important to screen for gestational diabetes. So these are the investigations which are required, and then what are the red flags which you should be aware of in the second trimester? Too much increase in weight suddenly, lot of edema of the feet, headaches, subcostal pains, abdominal pain which is not going away, any discharge or any bleeding from vaginum, yes, you must contact the hospital immediately. The common complications which can arise is rise of blood pressure, or what is known as preeclampsia, which is with edema of feet, rise in blood pressure, and a bloatedness of the abdomen, bloatedness of the whole body. It's a dangerous thing and it has to be treated. So your BP needs to be checked all the time whenever you visit the doctor. So what about the visits? The visits are generally once a month, unless your doctor tells you to visit more frequently or he demands you to come earlier. So generally once a month visit is enough, but any complications like edema of feet, rise in weight, please contact your doctor in the second trimester also. In generally, second trimester is a happy period because you don't feel much, you feel movements, you're excited, your nausea is not there, and it's a good period to be in, and that would end at 28 weeks when you would go into third trimester, which we will make you aware in the next video. If you have any comments, any questions, please do ask us in the space below and we'll reply to you. At our center, Thanawala Maternity Home in Vashi, we have an antenatal class on one of the Sunday mornings, where we cover diet in pregnancy, exercise in pregnancy, and lifestyle changes. It is taken by a dietitian and a physiotherapist. Very useful. You're welcome to attend it and ask all your questions and queries and have a good discussion with a group of women who attend that class. We also have a class which is more useful for the women in the second trimester or third trimester, where we talk about what happens during delivery, what to expect during delivery, and about breastfeeding and baby care. So these are the two classes which we have at Thanawala Maternity Home on a Sunday morning. You can find out more about it, you can register for it and attend it. Thank you.